The Prime Minister paid a visit to Toronto area senior centres today to highlight his budget's national dementia strategy. The Liberal government is setting aside $50 million over the next 5 years to implement the strategy. The money will be used to invest in targeted campaigns to increase public awareness with a focus on risk reduction, prevention and combating the stigma associated with the disease. A late-stage Alzheimer's drug was giving patients hope until it was cancelled. While there is still no effective treatment for Alzheimer's, in early studies, the drug Aducanumab melted away the protein plaques that are the hallmark of the disease, and people taking the drug showed improvements in some of their thinking skills. But last week, the drug's developers decided to halt 2 trials involving the drug. Joining me now with more on this is behavioral neurologist Dr. Sharon Cohen. She's also the lead investigator in Canada for this drug. Good morning, Dr. Cohen. Great to see you as always. So first of all, tell us about this drug and why it was giving patients hope and really doctors as well.
Absolutely. We thought this drug might be the one to make a significant difference. So there's huge disappointment that the program has been canceled. What Aducanumab is an antibody that has been shown already in its phase 1 study to completely remove amyloid plaque from the brains of individuals with early Alzheimer's disease. That's very important in the sense that we think amyloid is a key driver, an early factor, a toxic protein in the Alzheimer's process. And if we can remove it in what we thought were early patients in these studies, maybe people would do better. And there was some early signal that people were doing better in the phase 1 study. So the phase 3 study, 2 studies, over 3,000 people, that has recently come to a halt, was to provide further evidence that, not that we're reducing amyloid plaque, we know we can do that with Aducanumab, but that people are actually better off. Their disease is halted or slowed down.
But not reversed.
So, not reversed.
Okay. It's always
important.
But
if you can stop disease early, before people are very functionally impaired, they can live a good quality life. So what happened, there was a planned futility analysis. And that means rather than run the course of an 18-month or whatever length of trial you have, you're going to plan that at certain points during the trial, and this was about midpoint, you'll have an independent committee, a data monitoring committee, independent from Biogen, look at all the data for all the subjects that have gone through however many months of treatment on this experimental drug, and inform the sponsor, Biogen, as to whether they are likely, if they continue the trial to its completion, which would have been January of next year, January 2020, how likely they would be to be successful. So the data monitoring committee informed Biogen that there was a low probability that they would be successful. We don't know that that was 0. Okay. We don't know how far off we missed. So there's a lot of data now that Biogen is reviewing, that they've collected, good quality data that will inform us. So very disappointing that the futility analysis didn't say, keep going, right, which would give us a lot of hope that we're going to be successful. Still not a guarantee we'd be successful at the 18-month, January 2020 mark. But here we're saying low probability we're going to be successful. No safety issues. That's very important. So this wasn't halted because of safety concerns. The trials have been halted because of the lower probability than Biogen had hoped that they'll be successful.
So is there still reason for hope here?
Absolutely.
Now that this research, these trials have been done, could another drug maker come along and pick up where this one left off?
Absolutely. So that is actually happening, and fortunately we're not just doing one trial, learn the lessons, construct another trial. There are multiple trials going on. The pipeline is fairly robust. And what we can surmise from, or hypothesize from, what's happened with the futility analysis and Aducanumab not proceeding is, number one, that maybe it's too late. Amyloid's already done substantial damage, because we know Alzheimer's disease creeps up over about 30 years, and amyloid's building up for about 20 years before there's substantial symptoms. So although we think we're identifying people mild or at an early stage in the disease, they probably have had injury from amyloid for many years. So maybe we need to move to the prevention studies, which fortunately, are well underway. There are 4 prevention studies around the world and 1 that's still recruiting, the Generation study. Very important. Go early. Keep healthy brains healthy rather than wait until there's already disease and then try and play catch-up. Another hypothesis that is actually being tested is maybe at this stage of Alzheimer's disease, even though, again, these were thought to be mild patients, amyloid is no longer the major driving factor. Amyloid's the trigger, but it sets into motion other toxic proteins, one called tau in particular, and inflammation in the brain. And so maybe we need to tackle tau at this stage, amyloid in prevention, tau when you have symptoms. So it's kind of like with hardening of the arteries. Dr. Gold in Florida made a great analogy. He said, by the time you have chest pain and angina, you need a bypass, not the cholesterol-lowering agent. But if you're dealing with the early stages of hardening of the arteries, maybe that statin drug, the cholesterol-lowering agent, is what you need. So we're piecing it together like that. There are lots of anti-tau, not just compounds in development, they are in clinical trials, including at Toronto Memory Program. So people are eager to see what tau can do. Yeah. Probably in the end we'll need a combination and staged therapy, amyloid therapies early on, tau for later stages. And the third point that's really important to make is not all amyloid is the same. So with Aducanumab, we could clear substantial or all of the plaque-bound amyloid. So if you look at a PET scan, you see amyloid plaque, right, and you look at the treated patient after 12 treatments, after 12 months, and there's no plaque there. That's dramatic visually. But before we get to the amyloid plaque stage, amyloid's building up in different species, we call it. And there may be a more toxic species of amyloid that plaque doesn't represent. Plaque may be the end stage and actually a more benign, walled-off stage in the brain. And the earlier stages of amyloid may be the more toxic and injurious. And the Eisai Band 2401 study is continuing on, and that targets these what we call toxic oligomers or toxic protofibrils. So the reason for hope is that the pipeline is broad, that the Biogen study, Aducanumab study, will inform us about how to shape what we're doing already. We've got anti-tau molecules, we've got anti-amyloid molecules that don't just target plaque, and we've got prevention studies. So anybody who's concerned about their memory or their risk for Alzheimer's should step forward and wave their hand and say, you know, how can I help? Okay. And the scientific community is not giving up, and I always like to give patients the last word. We are informing, have informed all of our Aducanumab patients about the fate of the study they're in, and they are saying, sign me up for the next one. Yeah. They recognize they've contributed important data and important study, and now they're not saying, okay, that's it for me. They're saying, what else can I try? Okay, please keep at it. Thank you so much. We're out of time, unfortunately. We're going to take a short break, and we'll be right back with more news. Dr. Cohen, thank you. Pleasure.
You're watching CTV NewsChannel.